Hi, I'd like to review the patient-centered care PowerPoints. The objectives are to define patient-centered care and describe a therapeutic environment, explain the use of QSIN in nursing practice to provide patient-centered care, and describe patient advocacy. Person-centered. Families and friends of the patient are considered an essential part of the care team. Patient safety is the visible priority. Transparency is the rule in the care of the patient. All caregivers cooperate with one another through a common focus on the best interest and personal goals of the patient, and the patient is the source of control of their care. If I could offer a suggestion, if you could take some time and just casually review the Institute for Healthcare Improvement, IHI.org. IHI.org. It talks about bedside reporting and different communication projects they've had going on for the years. That group first initially started with the 100,000 Lives campaign, and their goal was to save 100,000 lives. And what came out of that project was the development of the rapid response teams that are now instituted in most of the hospitals, where a nurse, whether having tangible or intangible belief that the patient is deteriorating, can call a rapid response and immediately get a critical care nurse, a respiratory therapist, supervisor there at the bedside to help try and stabilize that patient or get them into the proper care situation. By doing that, it has nationwide decreased the amount of code blues that have taken care of, because most of the time code blues are not an event that happens spontaneously, but they could usually be predicted, and you could see a trend towards them. Professional nursing role. What makes a good nurse? They have personal attributes. They're warm. They're sympathetic. They're knowledgeable. That's oftentimes based on the nurse's knowledge and experience. They have good cognitive competencies. They have a purpose of thinking. They have a way of critically thinking to rationally decide on something. They have sufficient knowledge. They recognize potential problems and have a remedy for those potential problems. Once again, just like stepping back to the rapid response team, they're able to see trends. They know where to get resources, and they are able to create their judgment and their decisions and learn reflective practice. And they work on developing personal attributes to think critically. Sometimes that's looking critically at yourself. What competencies would that nurse have? They have technical competencies. They're able to auscultate a chest, listen to a heart. They're able to start an IV. They're able to properly assess the patient and then notice subtle changes. They are developing strong ethical and legal competencies. They understand ethical and legal ramifications of their actions. They have good interpersonal competencies. They promote human dignity and respect. One thing I always add with nurses is it's important to remember that it's not about you. It's about the patient, the patients. So many times at the end of a rough shift with a particular patient, may have been in someone that's irritable, grouchy. It really wasn't about me. It was more about them and the way that they are coping with their illness. So enjoy the rewards of mutual exchange and collaboration, whether that be with the patient, the family, or their co-workers, their colleagues. They establish caring relationships. They recognize that caring is an ability. It's a human mode of being. Caring is the essence of nursing and the moral imperative that guides us to nursing. Caring is both spiritual and a human consciousness that connects and transforms everything in the journey, that we are engaged both physically, spiritually, and emotionally with that patient on their healthcare journey. Establish those caring relationships and have the competency towards being able to work altruistically, thinking in the benefit of others. Caring is a special way of being. It's an ability. Care is culturally diverse and universal, that you look at all patients the same, that they're deserving of your care, but then you look at all patients individually, that they have individual wants, needs, desires. How do we care? We're present to the patient. We're engaged with the patient. We advocate for the patient, making sure that they get the best, they have full knowledge. We attend to their psychosocial, emotional, economical, cultural, and spiritual needs. Provide therapeutic communication and a safe environment. We keep them safe. We make sure that we communicate what the care of the patient with all disciplines that are involved, and with, say, the next shift. One of the things that also came out of the Institute for Healthcare Improvement was the initiation of bedside reports, where nurses exchange information in the presence of the patient and are able to get them involved in that process. Included in that is the introduction of the nurse, the oncoming nurse by the outgoing nurse to the patient, and that we have standard protocols for admission, transfer, and the discharge care. CUSIN. CUSIN was originally developed at Case Western Reserve University. It was started in 2005, and amended in 2012. It continues today. As a matter of fact, one of the courses that I teach at Ohio University is their capstone, the final program, and it's all based on CUSIN. CUSIN's able to develop is a whole system of looking at the patient and the system of care that as it's delivered. So key to that is the nurse's knowledge, skills, and attitudes. We want to make sure that in order to care for the patient, that people have the right knowledge, that they have the right skills, and that they have the attitudes to be able to care for that patient. So that can be carried on into delegating. We have to make, when we delegate an action in the care of a patient, we have to make sure that the person that we're delegating to has the proper knowledge, skills, and attitudes to be able to deliver that care. There's 5 competencies that we look at in CUSIN: patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. In my OU course, the students are looking at one of these competencies and trying to classify their projects. Like, do they want to develop a patient-centered care project where the patient is given proper, where they're ensuring that the patient has the proper knowledge before they're going into procedure, that the standard of care is being met. Teamwork and collaboration. A lot of projects deal with being able to make sure that there's a good flow and a continuity of care between other nurses and other disciplines. Evidence-based practice. Why we do what we do, and does it work? What's the best way of preventing an infection, a urinary tract infection in a patient? And that's to get that catheter out early. Quality improvement, where we set a benchmark that we want to achieve, and we continuously monitor to make sure that that benchmark is being met or that we're moving towards it. Safety. One of the simple things in safety is hand washing, making and preventing falls. and informatics. Informatics has a lot to do with communication, whether that communication is electronically via the computer or other communication technologies such as video or Bluetooth or whatever. But it could be as simple as having an old hard-bound register where we keep, a list of every patient that's admitted to a unit on a particular day. So nursing practice, that it's thoughtful, that has its values, and it advocates for the patient. So one of the key concepts that we talk about throughout this program and many programs, and it was emphasized to me as I completed grad school, is reflective practice, the process where we look back at an activity or an event and attempt to learn from it and how we can do better. One of the processes in that is journaling, where you look at an event and then in the care of a patient and journal it, and through that journaling process we're able to see it clearly and try and learn from it. So that reflective practice looks at our personal attributes, our knowledge base. Were we lacking something that we didn't, that would have helped in the care? Our experience, are we able to blend our competencies? And are we using the cues and competencies? Of course, our values and our judgment are always adding into that. And then that process that we use is the nursing process, where you'll hear the acronym ADPI: assessing, diagnosing, planning, implementing, and evaluating, where you'll look at identifying a problem, assessing what's wrong, and diagnosing what's wrong, planning interventions, delivering those interventions, and evaluating whether they were effective. Personal values, altruism, is to be able to put others before ourselves. Is autonomy, the right to patient self-determination. If a patient decides that they don't want surgery, even though everyone's suggesting that they should do that, they're practicing autonomy, and we advocate for patients' autonomies. One of the hard things that I had to learn to accept in my career is that people are allowed to make choices. They may be bad choices. They may not be the choices that we would make or choices that we agree with, but they are allowed to make those choices. And think about the patient that leaves AMA. So we respect the inherent worth and uniqueness of individuals. We act with integrity, whether we're true to our code of ethics and the standards of practice, and whether we're true to ourselves and the mission of the mission of the hospital that we work at. So, and social justice, upholding moral, legal, and humanistic rights. One of the things that we currently have in the United States is to believe that everyone should have access to care, and that was some of the motivation for creating the Affordable Care Act. Okay, you can go back and review the Code of Ethics from last week, and it's our standard, it's non-negotiable in order to act with integrity where it's non-negotiable, and it's an expression of our own understanding of how we're committed to society. Advocacy is the primary commitment to the patient, prioritization of good individual patient care rather than society in general. It's not the greatest good for the greatest number. It's treating that patient as an individual and making sure that they're getting their care. One of the things that I've heard when they talk about in warfare is acceptable risk, acceptable casualties. Whether we should quarantine or not quarantine. So what's good for the patient, what's good for society, whether that be their health or their economy. Okay, thank you. I hope you enjoyed this. Let me know if you have any questions or concerns.